Well, what a great start to this conference. It's always great to get a historical perspective of what these efforts in the state have been going on for all these years. My name is Raji Thiagarajan, and I'm from Maricopa County Department of Public Health, and I'm here to actually introduce our first speaker, Mr. Brodell. Mr. Brodell is based in Portland, Oregon. Eric Brodell works across the western United States with the Preventing Tobacco Addiction Foundation to raise the minimum legal sales age of all tobacco products to 21. Eric joins the Preventing Tobacco Addiction Foundation as a recent graduate from Indiana University School of Public Health. He completed his Master's of Public Health in Behavioral, Community, and Social Health, and also has completed his Bachelor of Science in Public Health Administration and Nonprofit Management. Throughout his time at Indiana University, Eric worked with multiple Bloomington community organizations, primarily focusing on improving youth health outcomes in low-income communities, ranging from physical activity and transportation safety to food security. Passionate about healthy living and preserving the outdoors for all to enjoy, Eric continues to work toward influence policy change and improve health outcomes for communities throughout the United States. So with that, could you please help me welcome Mr. Brodell to the stage?
Great. That's the button that works. Great. Morning, everyone. Thanks for having me. Like Raju said, my name is Eric Brodell, and I'm the Western Region Director for Tobacco 21 and the Preventing Tobacco Addiction Foundation. So we'll dive right in here. I know that all of you are familiar with this little guy, the three-legged stool of tobacco control policy, and today we're going to concentrate in my field on tobacco prevention education. In those two bolded things right up there, minimum legal sales age laws and tobacco retail licensure are what I'm going to focus mainly on today. So, the rationale behind Tobacco 21 is fairly simple. It's about distancing social circles and getting tobacco out of high schools, making it out of reach for individuals aged 13 to 17. See my simple little Venn diagram up there on the slide? Makes it plain to see that we have a little bit of overlap between the two groups here. 13 to 18-year-olds are in regular contact with each other, and in the current environment of minimum legal sales age laws, they can solicit tobacco products from their peers. Now, when we separate that, we see that there is still a little bit of an overlap between that 18-19 age group, and some may even have friends that are 21 reaching down into the 15s. But usually 21-year-olds have more wherewithal than to provide a 15-year-old with a tobacco product. That is, unless they are a user themselves. Another big piece of the rationale is brain development with Tobacco 21. We know that 18-year-old brains are not nearly as developed as 21 or 25-year-old brains. However, the policy really focuses on 21 because the decrease in tobacco use actually is much less from 21 to 25 than it is from 18 to 21 or 19 to 21. Risk assessment is not as thorough with 18-year-old brains, and even though kids know tobacco is bad, we've been taught that tobacco is bad since we were very, very young. We all know it's wrong. However, individuals still use it for the social effects and the acute effects that come along with nicotine use. Adolescents have a greater brain reactivity to rewards in general than young adults do, and because of their level of development, teen brains are uniquely sensitive to nicotine. Nicotine is a stimulant, so it stimulates dopamine production and makes your brain used to that overload of dopamine. What that does is provide more impetus for risk-seeking behavior down the line and opens up a lot more risk factors and continued nicotine use for the remainder of your life. Early tobacco use in adolescence creates a stronger addiction later on in life, and this is what we're trying to prevent with Tobacco 21. This is probably my favorite slide in my presentation. These quotes are 20 plus years old, and the tobacco industry has known that minimum legal sales age laws would work for this entire time. I'm going to read these just to make them resonate a little bit more. If you're really and truly not going to sell to children, you're going to be out of business in 30 years. And raising the minimum age for cigarette purchase to 21 could gut our key young adult market, where we sell about 25 billion cigarettes. Of course, this last 25 billion cigarettes is probably decreased since the 80s. But these two quotes here just go to show you that our opponents know that this is going to work. This is a great card to have in your back pocket when you're making arguments for Tobacco 21. The Institute of Medicine has also weighed in on this, federal government. Back in 2015, I'm sure that many of you are aware, there was a report commissioned by the government. It's about 360 pages long. There's an executive summary, don't worry. You don't have to read the whole thing. But I did, and these are 4 real key conclusions that they've made towards the end of their report. That Tobacco 21 will likely prevent or delay initiation of tobacco use by adolescents and young adults. The largest proportionate reduction in the initiation of tobacco use will likely occur among adolescents 15 to 17 years old. What we're really interested in here is that age group, that 15 to 17-year-old age group. How many of you know individuals that started smoking when they were in this age range? See a lot of hands. We're very concerned with this age group because, like I said earlier, the earlier you start, the stronger your nicotine addiction will be throughout your life course. Moving on to this third point here, impact on initiation of tobacco use will likely be substantially higher than raising it to 19. I made this point a few minutes ago between this difference between 19 and 21, and then 21 and 25. 21 is that sweet spot in the report. They modeled 3 different age raises and saw that 21 was the most effective. And finally, this will likely lead to substantial reductions in smoking prevalence, which is always our goal. Now we're going to get into a little bit about the success behind Tobacco 21. This little community here is Needham, Massachusetts, and I'm sure that many of you have heard of Needham before. But back in 2005, Needham, Massachusetts was the first community to adopt Tobacco 21 in the United States. They are a town approximately 2 miles wide, surrounded by 17 other Metro West communities that border Boston. And at the time, like I said, they were the only one with a Tobacco 21 ordinance. What they found was really interesting. We would expect kids or youth to go into the neighboring town and just buy their tobacco products there, or talk with one of their friends that was from a high school in one of the neighboring towns. But our graph doesn't show that that's what happened. First of all, the prevalence as compared to Needham was a lot higher in those comparison communities. So what we're looking at is the slope of this blue line, how much more dramatically that fell than this orange line that's kind of like a bow. We found a 48%, well, they found a 48% reduction in 30-day prevalence. And not shown here on the graph, but more important in my mind, there was a 62% reduction in that 20 out of 30 day smoking among adolescents. This is really important because these are the kids that are going to be the most addicted down the line. And having a reduction over 50% is huge. In this last point here, these declines nearly triple those found in the surrounding communities. Another important point to make behind the success of Tobacco 21 in Needham was their immediate decrease in sales to individuals that were under 18. Now, these were illegal sales already, but now it becomes even more of this roadblock to youth. In their minds, laws are not to be broken. As adults, we know that enforcement behind these laws can be contentious at times, but youth minds don't usually like to take the risk and break that law. So we see an immediate drop there. Huge decrease. But then we see a slight uptick when people caught on to 2 holes in the law in Needham. One was a grandfathering clause, and the other was that there was no real stick to enforcement as far as suspension and revocation of those tobacco retail licenses go. I'll go into that a little bit more later, but I want to briefly talk about what grandfathering clauses are. So some legislators think that it is unfair to suddenly make tobacco products for those who are addicted at age 18 unavailable to them for the next 3 years. And while suddenly that is not a good idea, and that's why we suggest a rollout, which I'll touch on later, what grandfathering does is make it increasingly difficult for retailers and clerks to figure out what the age is, what the date they need to check is for legal consumption, legal purchase. There'll be 2 different dates. Someone born, say, on February 22nd will be able to buy tobacco products, yet someone born on February 23rd won't. And how is that 18-year-old any different than the one that was born on February 22nd? I don't see a difference there. This keeps tobacco in the high schools for another 3 years or another 2 years, and really shows the rest of the state or community that the board doesn't want to take a strong stance on the law that they've enacted. It's important to set a precedent when we pass these laws. This is just a quick graph or GIF on the rapid spread of Tobacco 21 in Massachusetts. They have over 140 communities in the state now, covering over 60% of their population. And this is the textbook case of what we'd like to see happen in other states. From our foundation's perspective, a local movement. And from a tobacco control historical perspective, the movement is incremental. It's not broad sweeping motions where we introduce a bill and it happens in 1 year. The tobacco industry is too smart for that. They're too well prepared, and they have too many funds for us to be able to beat them in one fell swoop. So as this spread throughout the state, we have more and more momentum in the state legislature, and we hope to see Massachusetts be able to pass a law this year. This is another fun map. The Tobacco 21 for KC Coalition created this, and something interesting about their coalition is that it's headed by their Chamber of Commerce. Their Chamber of Commerce has taken a really strong stance against for many health improvement projects around the city, and they carry the torch on Tobacco 21 in Kansas City. This spans 2 states, Kansas and Missouri, and spreads into 5 counties. That just goes to show you the power of your business community for these laws. If it affects the retailers, you're going to need to have a stakeholder from that group on board. And to start the movement out with a Chamber of Commerce, they have all the momentum that they need to continue to move forward. And I'm sure that this map is now a little bit outdated. If you go on their website, it's probably, these blue areas have probably turned into red, and that there will be more blue areas coming. What they've done is involve their business owners at the front end instead of in the middle or at the end. Okay, now we're going to get into some best practices for organizing about Tobacco 21. Like I said earlier, tobacco control has historically been an incremental process. And it's important to get that local support before you move on to your big state trophy. Most likely, legislators haven't heard of the concept completely, and until their constituents are really interested in a law or a certain ordinance that they've passed, they don't really grab onto these concepts. Gotta give them something to look at. Find unlikely partners. That Chamber of Commerce is a huge unlikely partner. A sympathetic retailer who owns a mom and pop store who isn't against increasing regulation because they understand that they are the front lines of tobacco control. They sell the tobacco products directly to the consumer. They can stop illegal sales. Also, another great thing to suggest to your board or your city council would be community meetings, involving the community and seeing what their thought process is. And largely, this is a boon to your movement because support for Tobacco 21 laws around the country tops 65%. That's unheard of in most policies. And this is just something that gets the spotlight. People like the idea, and I have many people come up to me and say, why don't we make it tobacco 50, right? I wish. This bolded point right here, third, do your research. Know who your legislators are. Be interested in them. Show that you know what they've done in the past. This is a good and bad thing sometimes because you can find out that a certain legislator has taken funds from the tobacco industry. Recently in Oregon, we had an article from the Lund Report come out showing that approximately half of our supporters for Tobacco 21 in the state have taken funds from the tobacco industry. So this is important information to know before you start your effort. And then, if you can, assist in that drafting process. We have hundreds of local ordinances that we'd be happy to furnish and help develop an ordinance that works for your community. Some best practices for implementation, as I mentioned earlier in the presentation, tobacco retail licensure and Tobacco 21 or enforcement activities in Tobacco 21 are extremely connected. This is the teeth to a Tobacco 21 policy, having a robust enforcement activity to ensure that illegal sales aren't happening. And then this last point here on the slide, I talked about a phase-in period or a grandfathering period. The phase-in is an alternative to a grandfathering and is a best practice for implementation on Tobacco 21 laws. We have a 6 to 8 month grace period where you can do community outreach and education, educating those 18-year-old users of FDA-approved cessation devices, directing them towards the quit line. It's very important that they start this process of quitting in this phase-in period because they will not be able to access tobacco products at the end of that 6 to 8 month period. We have to take a hard line on these policies to make them effective immediately. I'll just gloss over this quickly because I don't think I have that much time left. Rural populations, I know a large portion of the state has rural populations. It's important that those community groups carry these policies. Want to make sure that the stakeholders really believe in it and we're not just coming in and saying, hey, this is what you need to do next. Many people don't like being told what they're doing, rural populations even more so. So it's important to take this on yourselves in your rural localities and continue that yourself. These also are just, we can talk about this more in the breakout session later this afternoon, some significant roadblocks to framing of the policy that you'll hear in the opposition, and it's important to have some canned responses ready to refute these arguments. And if anybody would like this presentation, maybe we can send around a list and I can get your emails and send it out to you. Legal challenges in Arizona. These are big, have a possible effect. SB 1524 was originally developed, from our understanding, to regulate qualified marketplace platforms. And what that is a legal term for Airbnb or Uber. The state didn't want localities to be able to regulate those at the local level, and that's why they created this law. However, Part A is still problematic for public health. And then SB 1487 is the follow-up to 1524, where a state legislator could complain to the state AG if a locality passes a law that violates the Constitution or is in opposition to the state law of Arizona. I will note that Cottonwood has passed an ordinance. They had 2 legislators send letters, and this has not happened yet. So it looks like 1487 and 1524 are a moot point, but somebody could bring this up. In 1524, it's important to note that there is a short section in there that says that unless it affects the health, safety, or wellness, and we should argue that it does affect the health, safety, and wellness not addressed by a law that's already in place. These are just best practices for implementation or the implementation process and organizing. You want to make sure that you're there during the process, that you're bringing people to testify, you're reviewing the bill, you're helping with the drafting process if you can. and really show gratitude to the people that have taken the torch on this, your champions. They are putting themselves on the line against the tobacco industry, and it's important to recognize wildly the people that will dedicate themselves to public health. These are just questions that you can ask yourself when you're starting to build your movement. How can you nurture the relationships that you already have in your community? Someone can connect you to your Chamber of Commerce, your Rotary Club, any sort of stakeholder group, a faith-based community group that can connect you. These are important people to bring into the process, people that care about the way their community's health is going. How can you improve on negative relationships? We can get into a little bit more on the discussion that we have later today, but really trying to bridge that gap with retailers who think that you're coming to take away their livelihood. It's important to empower those people instead of be the big bad public health person taking away their money, their livelihood. Oh, that just, okay. Sign local resolutions to, yeah.
Can we have those people from Yavapai stand and go back to that slide right there?
Yeah, that was my next one, but yeah.
Anyone here from Yavapai?
So I wanted to give a shout out to Jen Mayberry and the Yavapai Anti-Tobacco Coalition of Youth. They have done a wonderful job so far organizing. We've been working with them tirelessly to advance our Tobacco 21 efforts in Arizona. Jen is as much of an expert on this as I am, and if you have any questions, she would be able to answer them just as well. They're actively pursuing both state and local efforts, well, more local now. And this is a picture of 3 of their youth, Gunnar, Sophia, and the third? Daphne. Presenting to the Sedona Chamber of Commerce. The Sedona Chamber of Commerce loved this. They're seeing kids from their community being involved in their process. This is huge. STAND in Arizona, like Matt said earlier, it is a nationally recognized organization. Use this tool for Tobacco 21. They are the best messengers for this law. Another plug for Yahtzee. This is Gunnar Tillemans. This is him testifying in the House Health Committee. He did a wonderful job along with his colleague, Sophia. They seem to know more than the legislators did on this topic, and they just blew the roof off that committee. It was great. We're looking forward to working in Sedona and moving up into Flagstaff in the next few months. We have great support in Sedona so far, and since Flagstaff has been a leader in Arizona historically, we're really looking forward to hopefully moving into that community as well. Unfortunately, House Bill 2335 seems to be dead at this point. The chair of the Commerce Committee is refusing to hear this. While we could put significant resources into lobbying this individual, from our foundation's standpoint, the local efforts that will build this groundswell of grassroots support is really going to be what helps. Now for a national look, these are the 10 or 11 bills that are still alive. This is the most Tobacco 21 bills in the state legislatures that we've seen so far. Our trajectory graph is exponential right now for people learning about Tobacco 21 and enacting or trying to enact these laws. I actively work in 4 of these 10 states. Washington, Oregon, Indiana, and Texas all have great support behind their laws right now, and it looks like a positive path. Washington is a preempted state. They've tried 3 times. Their Attorney General, Bob Ferguson, as I'm sure many of you have seen him in the news in the recent months, is just a great champion for this policy, and he coined the term, "Let's not balance our budgets on the backs of teenage smokers." That is huge. If you come up with a revenue argument, use Bob Ferguson's words, those could not be truer. And finally here, I just have a little slide on other resources. The Public Health Law Center, now the Tobacco Control Legal Consortium, has wonderful model language for Tobacco 21 ordinances. They provide a lot of legal advice. What they cannot do is lobby for you or work at a really local level, they don't have the capacity for that. Campaign for Tobacco-Free Kids is another wonderful organization that we partner with a lot around the country. Their research department is robust. They have wonderful fact sheets and great financial information for you that you can drill down to the local level if that comes up in your discussions, which it most likely will. And then your voluntaries. Make sure you engage heart, lung, and cancer. They know the climate of the state legislature. They know climate of state politics, and they have huge volunteer bases to be able to help you lobby those state legislators. Come and testify in your city council or chamber of commerce or county commissioner meetings. And I have the 3 government relations directors' names up there. I'm sure that they won't mind if you contact them. Thank you very much for having me. I'd like to open up the floor for questions. Looks like I did an all right job. Yeah, Ken.
I see that Trenton, New Jersey has just also passed Tobacco 21 on February 16th.
They did.
Yay to my home state.
Oh, good. Yeah. They're having some difficulty with the state level bill, but New Jersey GASP is a wonderful organization, and they work hard to make sure that these laws are going to get passed. Trenton was definitely a huge mile marker for them. Yes, sir.
Eric, do you have any idea what the status is with the attempt to reach out to the Arizona House Speaker regarding HB 2335 this week?
I don't. We could look into contacting Nicole, Brian, or Joanna. They would be much more in tune with what's going on currently. After hearing that HB 2335 got held up, I've pulled back my efforts at the statewide bill and have rolled out more local effort just to make sure that we have that groundswell of local support. Yes?
Eric, the last I heard on that is that they're not going to try to get the bill heard. They're going to go back out and try some other things before we take it back to the legislature next year. This is kind of the introduction period, and you all know how many times we have to introduce something. So I think it is dead for now.
The climate just wasn't right this year. And a lot of times it does take that second or third try. Like I said, Washington's tried it 3 times at this point, and they're still having some difficulty. All right. Thank you all very much.